Good afternoon, Dr. Dan Yachter, the chiropractor. And I'm going to be going through this week's segment of news, views, and weekly updates. And as always, I thank you for joining me. And this information is also broadcasted inside of our private group, My Family, My Mission. You'll see posts in there, a lot of the information that I talk about throughout the segment. You can find the resources inside of our private Facebook group. If you've not joined there, go to My Family, My Mission, and you can find all that information there. So we're going to go ahead and continue with the breakdown of the material that I taught last Tuesday at the Hormone, Thyroid, and Stress Management Master Class. So we're going to talk about this, but we're going to talk about the content within the context of chiropractic and the spine. I had somebody say to me last week, what in the world does the spine have to do with hormones, with thyroid, with stress? What is the connection there? I don't get it. And I get it, here's the spine, maybe my neck hurts me. I get it. It's my neck, my spine, my vertebrae. I see that correlation, but I don't understand how my hormones have anything to do with my vertebrae. I don't get that. So we're going to talk a little bit about that during this segment. And thank you for all who are joining us. And CC, I see you jumping on there. And we're gonna dive into the information here. And as it goes back, and last week I talked about how we're going to take all of that content and over the next several weeks break it down and talk about a few different what I'd call micro topics in regards to hormones, thyroid, and stress. I cannot tell you how many people I see clinically, I speak with out in the community who are dealing with diagnosed thyroid issues, hormonal concerns, hormonal issues in general, and are crying out for help and are really not getting any help at all, any answers. And they're really, in my estimation, looking in the wrong place. They're looking in medical model, the allopathic paradigm, to give them answers, and they're not going to find any there, at least any long-term good, healthy solutions. So let's go ahead and circle back and talk about stress and just kind of, I guess, re-preface the conversation here, going back to last week, how stress impacts, first and foremost, our brains. So right above the pituitary in the brain, you have a part of the brain called the hypothalamus. The hypothalamus is what I call the boss of the neurology, the nervous system. It is built for survival. It's there to protect us from physical, emotional, chemical stress. It's there to figure out if that physical, emotional, chemical stress is a threat, a true life-threatening threat, or a non-threat. And based upon its interpretation of our environment, it determines whether or not to put us into sympathetic fight or flight or freeze, adrenaline rush, or relaxatory. Is this a situation where I could just kind of hit the brake and chill out, rest, digest, feed, breed? This is the healing part, the repairing part of the nervous system response. So that's what it's trying to figure out all day long. The stimuli that are around me, the stressors that I'm engaging with and I'm encountering, what do I do with it? Do I hit the gas pedal or do I hit the brake? All day long, it's trying to figure that out. And where this response comes into play regarding hormones and thyroid, again, just to kind of give you the background on this again, if you are in fight or flight, chronic, long-term stress, you may not feel like you're in fight or flight constantly because the body figures out a way to compensate and adapt long-term, but the stress causes a release of not only adrenaline, but also cortisol. Cortisol is always there in normal amounts in the body. It's a hormone, it's a stress hormone, but cortisol is always there. It's, as we discussed last week, it's there to regulate heartbeat, heart rhythm, immune system. It's there to regulate a lot of different things in the body. Blood sugar, it's the most powerful regulator of blood sugar out of all the hormones, including insulin. So cortisol is always there. However, chronic fight or flight, bound by stress, worry, fear, anxiety, causes long-term elevated levels of cortisol, daily elevated levels of cortisol. And there's a phenomenon in the body known as cortisol steal. And this phenomenon is when your body takes all of the hormonal resources used to manufacture all hormones, including sex hormones, testosterone, estrogen, progesterone, DHEA, all of these hormones, and it reappropriates all of the resources toward cortisol steal syndrome. Or it's also known in the medical literature as pregnenolone steal, but that's another major hormone. So all of the resources are reappropriated down this channel, down this path, down this river to producing, manufacturing as much cortisol as possible, as much stress hormone. And when that happens, it steals away from the resources needed to produce hormones, especially sex hormones. So if this goes on long enough, you will deplete the hormones, especially things like progesterone, which is a very critical hormone for the body in many respects, one of which is one of the most powerful anti-inflammatories of the body, anti-inflammatory hormone. So again, we start off by understanding that chronically elevated levels of cortisol due to a perceived threat in the environment or experience or memory causes this cortisol to steal away, the excess cortisol production to steal away from vital hormonal production. There are 50 plus major hormones in the body, right around 50 major hormones in the body, and they will all be depleted in order to create as much cortisol as needed or as necessary. So that's kind of how the hormonal dance occurs in regards to stress. One comment on thyroid health is this: if you have high levels of cortisol, which puts your body in a hyperdrive, fight or flight or freeze, running for your life, thyroid hormone, T3, it accelerates things in the body. It accelerates metabolism. It speeds the system up, active thyroid hormone. So we have an innate intelligence inside of our body, always there. She's always there to protect and guard us and make sure that we're living a balanced life. And so what happens is, since thyroid hormone speeds the system up or makes the system go, if you have chronically elevated levels of cortisol, which makes the system go fast, innately your body knows you're in danger of having simultaneously elevated levels of thyroid hormone and cortisol. So there's an inhibitory pathway, a negative feedback loop that will shut down or suppress production of thyroid hormone. If the thyroid senses elevated levels of cortisol for long periods of time, there's a negative feedback loop into the thyroid, telling the thyroid to downregulate production of thyroid hormone, in particular inactive T4 thyroid. So what happens is the thyroid gets depressed in order to make sure that you don't, basically explode. You don't have spontaneous combustion. And, or if both are elevated at the same time, it can blow something out. You can have a stroke or heart attack. The system's just going to go in a hyperdrive. So the body tones down thyroid function, which can result in a lot of the common thyroid symptomatology, or it's attributed to a deficient thyroid. And what are those things? Many of us know about these things. They're what? They're things like weight gain, hair loss, hair thinning, constipation, fatigue, lethargy, even cold intolerance, depression. These are some of the more common diagnosable or diagnosed symptom signs that go along with a depressed thyroid. So again, if you're going to first and foremost, if you're going to fix the thyroid, you got to fix the stress levels. You got to fix what's going on with the hypothalamus and the cortisol steal and this whole deal that I just talked about before. So that's how that kind of plays how it all plays together. And now going back to, how does the spine factor into thyroid health, hormonal health? What is the part that the spine plays into it? And again, as the weeks go along, we're going to break this thing down even further and get it quite a bit more granular as we talk about all of the different cogs in the hormonal picture and thyroid picture. But first and foremost, the thyroid is innervated and driven. The function of the thyroid is driven first and foremost by the nerves that are coming out. C5, 6, 7, that cervical spinal area has nerve fibers and pathways that are bringing energy, instructions, information right into the thyroid, allowing it to work. The thyroid is a dumb piece of tissue. It doesn't work on its own. It's a piece of meat, but it needs a nerve leaving the neck, and it's carrying instruction from the brain into the thyroid to make it work. The thyroid just doesn't simply work on its own. It needs a nerve going to it to bring nerve innervation or nerve impulse. So that's one way that the spine factors in. The spine has to be healthy. The spine is out of alignment, subluxated, interfering with the communication between the brain through the spinal cord, out of those nerves into the thyroid. You're going to have a problem. You're going to have deficient nerve impulse or nerve supply. The other part that it plays in regards to hormonal health, sex hormone health, is that you have nerves that are leaving down in the thoracic area, the lumbar area, that are coming out of the spine, that are going to ovaries, testicles, uterus, that are making those glands work properly. Another factor in regards to the spinal relation to hormones. I share this with patients all day long. If you're a patient watching this, you know we have this discussion. I have this discussion with every patient at least once. The importance of posture, how posture plays a role, especially, for example, you have, again, the pituitary, the hypothalamus involved with hormonal control, the sella turcica, where the pituitary, the seat of the pituitary, and right below that, you have the brainstem, you have the spinal cord that comes right off that area. If you have forward head posture, you're walking around with your spine off the plumb line, forward head posture. Some people are walking around with 1 inch, 2 inches, 25 millimeters, 50 millimeters. The head's all the way out. They're on the phone all day. They're on a computer all day. They just have awful posture. They're driving all day with their head forward. That creates a mechanical stress and strain on the spinal cord and the nerve roots. It also creates tension and pressure and creates a tension on the brainstem and the tissues, because the spinal cord is attached to all of that going up into the brain all the way to the hypothalamus. It can create tension on those brain structures, which of course creates a structural tension and stress on those brain areas, on the hypothalamus, which creates a structural, constant structural stress, puts the nervous system in fight or flight, and affects hormones globally. Everything downstream is now affected. So you have a structural stress on your neurology, which directly impacts your hormonal balance. This is a discussion that's never factored in to the hormonal picture, your thyroid picture, by your medical doctor, by your healthcare practitioner. And not their fault. They're just not taught this in school in most cases. They are not taught biomechanics. They're not taught, neuromusculoskeletal relationships as it applies to hormonal function, thyroid function, stress, holistic health, and well-being. So as chiropractors, this is the lens at which we look at the body. Not that you need something exogenous to come in. If your thyroid is off or your hormones are off, the first question we ask is not which pill, potion, lotion, injection, cream, topical cream, pellets we can put into you. We don't look at the body that way. What can we put into you to manipulate your hormones, your thyroid? The question that chiropractors ask, chiropractors are doctors of chiropractic, DC, doctors of cause, trying to figure out, why is there an internal balance? How do we remove the interference to allow your body itself to bring back the balance, and thereby balancing the hormones, balancing the thyroid by itself? It already knows how to do that. So today I wanted to share the perspective of not just the chiropractor, but the spine's involvement in hormonal health, thyroid hormonal health, sex hormones, sex hormonal health, stress hormonal health. All of this comes together and it's all connected and wired back to the spine. You can't leave this out of the conversation. So a really simple postural hack that I wanted to mention is, and in our office, we have all kinds of different structural corrective processes and procedures and techniques and plans that we bring patients through. But one of the simplest things that you can do throughout the day is just being aware. And again, as the weeks go on, I'll show you different things that I teach patients, but just having the awareness is today, ask yourself this question: where is my head in relationship to my body? Am I working on the plumb line, ear over the shoulder, over the hips, over the knees, over the ankles? If you're sitting, it's just ear over the shoulders, over the hips. Look around you. You'll get a very quick understanding of what not to do. It's incredible in terms of what this is doing to our spines, the phones. Just look around wherever you're at. If you're at like a mall today, or you're just in a public place, you'll see 9 out of 10 people. You're in a restaurant, this is what they're doing. They're just sitting there like that. Okay. They're literally not only destroying their structure, but they are creating future hormonal problems, or they're worsening current ones. So just being aware throughout the day, where is my neck? Start with the phone up here. I always love it. I don't love it. I just think it's amusing because I do have this conversation with patients. Let's start with this. Don't do this anymore. And what happens is I walk into the adjusting rooms today, and I know if you're one of my patients listening or watching, this is not you, but I walk into the adjusting rooms, and of course, we usually have patients resting on their stomachs or their backs, kind of horizontal, out of gravity. They're more relaxed. You get a better adjustment. But I walk in and they're sitting there and they're doing this. They're curled up, and I call it the Nautilus shell. And I'm like, well, I'm glad you're here, because if you didn't have spinal damage before, you do now. And now I have something to work on. So it's just having the awareness. Where is your neck? And think of the position of your neck having a lot to do with your hormonal health. So start there. Simple postural hack. Just focus on or be aware of, where is my plumb line? Where is my head? Where are my shoulders? Where are my ears in relation to my shoulders? Are they lined up throughout the day? Start by keeping your phone up here, right? If you're reading a book, here, put it on a stand. Start thinking of these things. Have the awareness, because yes, the position of your spine, your posture being the window into your spine is the window into your nervous system, which again, we know has everything to do with hormonal health. Start there. The simplest place to start, in my estimation. So thanks for watching. And again, another mention for November 18th, Tuesday, 6:30 p.m., diabetes reversal, blood sugar control masterclass right here held at the office. I'm going to have a very special guest speaker coming in to help me teach on that night. And you're going to have to wait and see who that is. Don't ask me, because it is a surprise. And the other thing to keep on your calendars, starting, oh yeah, the weather is glorious. Yes, CC. We've got amazing weather today and coming up through the weekend here. And starting in the middle of November, we are going to be kicking off our holiday celebration. Our Christmas decorations are going up. We're going to have a very special thing that we'll be doing for the Christmas season. Our office patients are going to love it. So keep all this stuff on your calendars. And as always, I appreciate you guys joining me. Thank you so much for being with me on this segment of news, views, and weekly updates. We will see you next week. God bless.